Good morning. I'm convening the Emergency Medical Services District number 2 board meeting. I believe we first of all have the approval of the minutes for April 19th.
Thank you, Mr. Chair. Move approval of the minutes for April 19, 2011.
Second. It's been moved and seconded to approve the minutes of April 19th, 2011. All in favor say aye.
Aye.
Aye. All opposed. Motion carried. Very good. Okay, now moving on to the agreement.
Good morning, Commissioners. Doug Smithley from Clark Regional Emergency Services Agency, the EMS manager that helps oversee the contract on behalf of the district and participating jurisdictions. Today, the EMS Administrative Board, which is your Citizens Oversight Board composed of legal representatives, public health, or not public health, but healthcare administration, business, finance representatives, are coming to you today requesting that you consider that this first responder agreement meets the provisions of subcontractors within the contract. The agreement that you might recall is based on earlier contract negotiations back in 2009.
Could I interrupt you?
Sure.
For the public and for me,
yeah,
define first responder and subcontractors.
You bet.
Oh,
you bet.
Maybe you're going to
well, the first response are the fire first responders. Typically, an EMS system is designed around at least getting first response there, hopefully within 4 to 5 minutes within the urban area for those critical patients, typically your cardiac arrest patients, and followed up by the ambulance service, which typically then provides a paramedic or advanced life support ambulance service and then transports the patient. The use of subcontractors in the provisions of the contract, there's some certain things laid out within that section of the contract that says if you, the contractor, in this case AMR, are going to be using subcontractors, it needs to either not increase or actually decrease overall costs. It should not negatively impact patient care, and that the medical program director and the district approve it. So that's
Who would a subcontractor
the subcontractor could be, for example, say AMR says, well, we want to have someone do the non-emergent ambulance business for us, so they subcontract for that. Maybe another ambulance company. Say for example, they decide we don't want to do the dispatching anymore, so we want to subcontract out for the dispatching, for Cresta to do that.
Okay.
In this case, because this agreement has first response slowing the clock, extending the clock another 2 minutes for the ambulance contractor. In effect, the first responder is providing a provision of ambulance service, at least is helping meet that response time requirement. So we use that same provision.
That would just be helpful for me.
Sure.
It's not in the definitions of the contract. I was looking where for it.
Yeah. Chris, did you have any?
Well, I think to simplify it, probably the bottom line is, in this case, what AMR wants to do is they want to utilize, I think the board actually encouraged them to utilize the fire districts to the extent they could in the provision of their emergency service. And what this agreement would do, or if the board approves this, it would officially sanction AMR entering into agreements with the fire districts and helping to share the cost of the fire districts providing first responder services to the citizens of the county. So it more closely aligns the fire districts and AMR to provide a unified service for the benefit of the citizens in ensuring they get quick care and appropriate care under our ordinance. So I think that's maybe a simple statement.
And would this help? I know you said it over and over again. You have an incident and 4 or 5 rigs show up.
Right. Yes. In that regards, we're already working on that. This could certainly be a piece of that. I think more importantly, we're identifying really the priority of patients based on their real severity. And in this case, Vancouver Fire, for example, aren't responding on certain low priority patients. It's just the ambulance provider. So we are looking at that area. Really what this does is recognize we've got currently deployed advanced life support resources out in the community provided by first response in the urban areas mainly, and then also the ambulance contractor. Let's make the most efficient use of those ALS resources while at the same time not compromising patient care, and we feel this agreement meets that provision.
Okay. So I kind of got you.
Oh, no, that's fine. That's fine. Well, what I was going to say was one of the biggest challenges that we had during these negotiations, and we continue to have, is obviously the decreasing revenues that the ambulance contractor has been experiencing. For example, I think in the past I've reported they were at 60% in 2000, and they're now down to around about 43% collection rate. That's being experienced nationwide. Public providers, the first responders throughout the country, are also experiencing decreasing revenues, obviously because of the decreasing property tax and sales tax. And so when we were negotiating the extension to this contract, AMR said, well, we're interested in another 2 years, but we're going to need to increase our average patient charge pretty dramatically if you want us to provide service for another 2 years. And we said, whoa, wait a second. We need to see if we can get some more efficiencies. Give us that additional time so where we can really look at a system redesign, which we've all been working on. And so led by Jerry Overton, who I think a lot of you guys know is a recognized international system design expert, as well as representatives from the EMS Administrative Board, AMR, and the first responders. Over a year, we worked on looking at ways to improve efficiencies. And this is one of the things that we were able to accomplish in those negotiations that resulted in the contract being amended, that reflected really the provisions of this agreement. And as a result, it decreased what was at one point a request for a 20% increase to the average patient charge down to that 5% increase, which was still a challenge for us to get approved. So this is one of those key provisions that were negotiated a couple of years ago with AMR and the district. So this now then brings the agreement forward, kind of describes to you what that agreement's going to be, how the first responders will get reimbursed for providing that services through the cost savings that will be shared by both the contractor and the first responders. And I'm here if you have any other questions.
Thank you, Mr. Joe. Just a question about the schedule. We have a Schedule A that has some definitions within it for excuse me, the zone where the call would come from, whether it be urban or rural, and within that, the service provider, and then a determination of hot or cold with regards to whether, how fast you need to get there. So I'm assuming 911 dispatch would be making the determination as to whether it was hot or cold.
Correct.
So how are they making that determination? How do we, I assume it's something you already do, that when dispatch is calling up and first responder, that they let that first responder know what's going on. How do you make the determination of hot or cold?
The dispatchers use a system that's called medical priority dispatch, and it has about 340 different call types. And so within those different predefined call types, they identify what is the acuity of the patient. Should it be a hot response, lights and siren, or should it be a cold, non-lights and sirens, or non-emergent response? And there's a lot of research out there that shows the efficacy or the safety of using that type of priority dispatch system. It's very accurate in identifying when you truly have an emergent patient and when you don't have an emergent patient. So that's how we'll be defining that. So they'll know, the first response and the ambulance provider, they'll know when this is a hot call or a cold call. And we'll be able to also track when the first responder is advanced life support, when they have a paramedic on board, and when they don't, which is one of the requirements to extend that clock for the ambulance contractor.
Okay, great.
Okay. Any other questions?
No, sir.
Is that it?
That's it.
So, what are we approving today? There's not a...
You're approving, we're asking, the EMS Administrative Board is asking that you approve the agreement that's attached to the staff report as meeting the provisions of that subcontractor within the ambulance contract. In other words, the medical program director has determined that this subcontract would maintain patient care, or enhance really patient care, we believe, and that it also does not increase costs to the current contract. If anything, the goal here is to reduce those costs.
So is it just called the first responder agreement?
Correct. Yes.
The current contract between the county and AMR prohibits AMR from subcontracting without your approval. You are now giving them that approval to enter into this agreement that's called the First Responder Agreement.
Oh, okay.
Okay?
Is there anyone of you wishing to testify on this? Seeing none? Oh,
I will.
yeah, come on out.
I'm Dave Fuller. I'm the general manager for AMR, and I certainly appreciate you guys reviewing this and taking your time today.
Thank you.
Actually, one of the challenges that you had laid out for us when we went through the initial extension was really to try ways to be more efficient and try and make sure that we're using all of the resources that are currently available in the county to the extent possible. What this agreement does is really for the first time be able to take your first responder response system and the ambulance response system and actually tie them into one EMS system. It gives us the ability to really focus on putting the closest paramedic on the scene at the quickest time. Currently, when we have two disparate systems, we don't have that ability. This agreement actually allows us to communicate, coordinate together, and really focus on putting the paramedic on the scene. And at the same time, allowing the system to be more efficient. I believe this is a great opportunity for us to do this, especially as we're looking at the system redesign and what things that we can learn from that going forward into the next RFP process. So I would obviously ask that you approve it today.
Excellent. Thanks for all your work on this. I appreciate it. It was a good step along the path.
And I thank you very much. I think one of the things was, especially with healthcare reform, we've always seen first responders over here and then healthcare starts over here. It's been interesting since we've been involved with you that no healthcare starts at the patient's home or the accident or wherever, and then it continues through. So it's a good conversation.
You bet. And I might mention that last night we had a work session with Vancouver City Council, and a couple of the council persons were concerned with this agreement. There was the thought of, well, is this the way that first response is going to get in the transport business? And I know that the first responders here are not interested in the transport business. They were also concerned, or a couple of the council people were concerned, is this going to compromise patient care because now the ambulance is going to have an additional 2 minutes extended to their response times? And in fact, if anything, what we're doing is really looking and holding accountable the first responders to a response time standard and being able to measure their response times. And also there's a few patients that are critical to make sure they get to the hospital right away. And we'll be measuring their on-scene times, to make sure that we don't compromise that time on task to make sure they get to the hospital right away. So if anything, we see this as enhancements. I think what we'll need to do is have some work sessions with a couple of those council people. But we wanted to flag that for your attention because that was one of the concerns that they had last night.
Very good. Are you okay? Okay.
I am.
Like a motion?
Thank you, Mr. Chair. I move approval of the public-private agreement titled First Responder Agreement that meets the ambulance contracts provision for use of subcontractors to the EMS District No. 2 Board.
Second. It's been moved and seconded to approve the first responder agreement. All in favor say aye.
Aye.
Aye. All opposed? Motion carried. Yes?
Before we adjourn, Mr. Chair, I might, as long as we got all you guys here, two things. First thing is there is a conversation going on at the state level with regards to money flowing back from the state, and I was just briefed on it yesterday by our county administrator, Mr. Barron, and it sounds like there's going to be a continued discussion at the state level as to whether or not we get additional funds back from the state by using a different formula. Looking at currently we get about $85,000 back. Correct, sir. And under the new formula, that would be a per capita formula with a base amount that we would get $185,000 back, which sounds like a very good thing. It also sounds like there is some strife within the emergency services organizations around the state because there are a few of the larger organizations that wouldn't get as much. Snohomish, Pierce, King counties. So certainly from my standpoint, anything we can do to provide equity in the money that goes into the system and then comes back, and recognizing the fact that you guys are working with a lean budget over there, and up to now it sounds like the system has punished you for that. That the bigger your budget, the more money you get, and I certainly don't want to be the one asking you to just blow your budget up and make it bigger and so that we can get more money back. That doesn't make any sense. So so whatever we can be doing to help to support you in that. Certainly, I think.
I think we should.
Yeah.
Very good.
Yes, we are. Commissioner, thank you. That's, you have authorized me to sign a letter as a member of the CRESA board that all of the members of the board, Chief Molina has agreed to sign it as well. There's 9 of us on the board. We will send that forward, and we're very hopeful that that will have some difference with the governor in changing the WAC, changing the distribution formula of that emergency management fund.
That'd be great.
And would that help coming from the county also?
Yes, I'm sure that I think they were going to contact WASAC as well to seek the board's approval on that. So
WASAC's board?
yes.
Well, that'd be interesting.
Yes.
That would be interesting.
I think we may have to do individual county.
Okay.
Yeah.
We can do that too.
Since there's probably a difference of
draft a letter
opinion
for you,
on that.
Mr. Chairman, right now.
That'd be great. Thank you. And then the last thing I had was private bridges. I was speaking with one of our planning commission members, and they are discussing private bridges and the standards, and I hope that you're all participating in that. We need your help to make sure that whatever we come up with makes sure that that when people are building those private bridges out there, that they're meeting the standards necessary to carry a rig across to save people's lives.
Right.
So appreciate your help on that. That's all I have.
Okay, thank you. Meeting adjourned. We'll reconvene in about 5 minutes.